everybody. We're always so good about kids and immunizations, but have you ever wondered, do we as adults need immunizations? Absolutely yes. We as adults absolutely need immunizations. Now, there are many different kinds of immunizations, and based on what our health conditions are, these immunizations are recommended for you. However, there are a few important immunizations that almost all adults need. Let me start off with the tetanus vaccine. Now, in India, we're pretty good about the tetanus vaccine. Now, this comes as a combination of tetanus, diphtheria, and pertussis, and these boosters are recommended at least once in 10 years. The next vaccination that I want to talk about is pneumococcal vaccination. We're not very good about this vaccination, but this is an important vaccination that all adults must have. The pneumococcal vaccine protects us from pneumonias caused by certain bacteria. Now, is it 100% effective, and does it mean that you're never going to get pneumonia again? No, it doesn't work that way. These immunizations protect you from the pneumonias, bacterial pneumonias, but you might still get the infection, but the infection can be lesser intensity and decreased hospitalization rates. So the elderly population especially will benefit from these vaccines. The flu shot or the influenza vaccine is something that is very controversial. There are many people who say no need to get it, and there are people who say that you should get it. Now, why is that so? Now, we have learned recently, especially with COVID, that viruses mutate. That is, they keep changing every time they evolve. The seasonal flu vaccine is based on the previous year's flu virus strain. So this flu virus could have mutated, usually does mutate every year. And the flu virus vaccine is made from the previous year's strain. So if the flu virus has mutated heavily in this year, your vaccine from this year might not protect you effectively. However, why do we still recommend it? Because you at least get partial protection. We are also learning about how the viruses mutate, and there is something called immune escape, where the immunity that you have gotten either from the flu vaccine or from previous flu virus infections are now not effective for the new mutated strain. In pregnant women especially, the tetanus virus and the flu vaccine are recommended, so definitely talk to your physician. The shingles vaccine. Now, shingles is a painful rash that adults get. The shingles vaccine is another important immunization to consider, and this is usually recommended for adults over the age of 50 years. The shingles is a painful rash caused by a previous chickenpox infection. This particular disease can be pretty debilitating because the pain either during the rash or sometime even after the rash has disappeared can be pretty painful. The vaccines protect us to some extent from this pain persisting even after the rash and from some of the complications that can be caused by shingles vaccine. When you want to know more whether you should be taking this vaccine, definitely talk to your physician about the pros and cons of these vaccinations. However, remember that these vaccines are important. They're important to keep you healthy. Remember that prevention is always better than cure. Thank you so much.